Lana James, and I'm the Managing Director of Inkwell Consulting.
I'm Carrie Robinson, and I'm actually Algonquin from Quebec, but I pretty much grew up in British Columbia, and I live in Vancouver right now. I work for the Canadian Aboriginal AIDS Network as a National Youth Coordinator.
My name is Erin Konsmo, and I'm originally from Innisfail, Alberta. I'm part of the Métis Nation of Alberta, but currently residing in Toronto or Mississauga of the New Credit Land. And I currently work for the Native Youth Sexual Health Network as an intern, as well as I'm the Alberta representative on the National Aboriginal Youth Council on HIV.
So my name is Mezar Dowlet. I work for Asian Community Services, and I do youth work with specifically with LGBTQ Asian, Southeast and East Asian youth.
My name is Jeremy Jones. I am Coast Salish. I come from the Snitnawas Reserve, but I also have ties to the Nuu-chah-nulth people and the Kwakwaka'wakw people. And I've been on the youth council for three years, and it's been pretty rewarding.
I think the first thing is to understand that we are allies from the outset.
When we relate to other people, we always, you always relate back to who you are and where you come from. And so we're Algonquin from Quebec, and we live in BC with lots of Indigenous youth and Aboriginal people who are from BC nations and bands. So anytime that we're interacting with other people in our own community, it's always, this is who I am, this is where I'm from, this is what I do, and then you naturally make connections. So I think that it's just, it's just the importance for Indigenous people, it's the importance of knowing who you are and where you're coming from, whether you're non-Indigenous or not, and making sure that you recognize that in someone else and are able to naturally make the links that will kind of allow you to move forward.
Allyship, especially in the Indigenous context, in the history of it, has not gone well in a lot of cases, and it still has a lot of bumps to be worked out in terms of the different groups that have colonial histories, because while we have similarities, we have different experiences of of colonization, and so I think whether or not it's allyship between adults and youth, or between Indigenous peoples and new migrants, or Indigenous peoples and people of color, that we need to be able to hold those distinctions with power and with strength, and to make sure that those aren't collapsing.
I think when you serve specific groups, it's really hard to collaborate because there's a limitation of my work and then their work, and if I invite somebody for a non-Asian within our group, I have to see how my youth react, or if they invite me to their work, I don't know how. I have to see if there's enough Asian youth for me to do workshop or something like that. So it's really hard, but in different capacity, like sharing information, sharing resources, that's really still something that we can work with as allies to each other.
My name is Amelia Murhar. I'm a health promotion worker at Blood Test for Direction Center, and that's in Whitehorse in the Yukon Territory.
So my name is Matthew Taylor. I'm from Vancouver, BC. I'm the program manager for Hustle Men on the Move, which is outreach and support for male and trans sex workers and identifying and supporting street-involved youth.
My name is Jeremy Dice. I am the director of Jared's Vision, and we work in schools and communities to address homophobic and transphobic bullying. One of the biggest challenges is the lack of national vision, and I think in the last probably couple of years we've seen a lot of organizations coming together to run national symposiums and forums looking at stuff intersectionally and divergently, so different cultures and communities, sexual orientations, gender identities, and so forth, and looking at the challenges they're each facing, and also looking at issues together, which is really exciting. So like poverty and, homelessness, or like queer identities and like bullying or sexual violence or safer sex. And I think it's exciting because these are issues that sort of intersect and touch upon each other. in people's daily lives, and so to see agencies that are doing work and looking at their intersections is really exciting.
Seeing more mental health issues is something that I've been noticing as well in youth, but there's not really more mental health supports. I know the Yukon Territory doesn't even have a Canadian Mental Health Association chapter, but we're working on that, and I have a little renewed vigor to work on that now, especially realizing that it's a pan-Canadian problem. And I've gotten some really great resources from the resource table and talking with people, and some really great quotes to bring back, which I have working on making them into a song.
I think one of the things around survival and burnout, especially frontline service organizations and programs and workers, nonprofit work, right? How it's pretty much across the board that nonprofit work is a struggle, is survival, is challenging. Pots of money are very small. Project funding is a scramble. And it's not just, it's kind of like when you're in your little bubble. I'm in my little BC bubble and in Vancouver, and I'm working and I'm seeing it play out, but it's actually playing out on a national level. And so that's interesting to see. So that's, unfortunately a challenge, but also good to connect with people who are going through the same thing, because I think we can only talk about success and move forward if we get together and talk through our challenges.
So my name is Ceranto, and I work for the Positive Youth Outreach Program here in Toronto at the AIDS Committee of Toronto Act.
Some people find it necessary to look at alternatives and to look at creating systems for doing HIV work that maybe address things like looking at the early roots of our existing systems that we're all working in across the board, and looking at how things like structural violence and colonialism can act as barriers to our work. And then possibly looking at ways of not just stepping around those barriers, but not just stepping around systemic issues, and looking at how you can do the HIV work in new and innovative ways.
Until researchers and the conversations and anybody involved in understanding how violence affects HIV rates, until they start making some of those larger connections and talking about the structural violence that happens, whether it's in conferences like these that still maintain very individual behaviors versus looking at the larger structural inequalities, then I don't think that we're going to do justice of changing the rates of HIV in our communities.
Another thing that was really interesting for me to hear that I had no idea was that the first youth conference was done in 1990, which was 22 years ago. And Laurie had said then there was approximately 300 people that got together for the conference. And here we are 22 years later, and we have less than 100 people, which I'm really, really glad that we had this opportunity to be here. But it makes me wonder if, youth issues are not as much as in the radar, because, even if you take 300 in the past and just less than 100 now, so, what's happening is not as important anymore. I don't know.
I'm Mason Makla. I'm a collegiate citizen from the Northwest Territories, and I work for the Community Action Research Team. It's we're community-based researchers.
Yes, my name's Nikki, and I'm from Montreal. I work as the health educator at Head and Hands, which is a youth community health organization.
I think that one of the great things we can do is be grounded in our own bodies and minds and support other people in staying not only sane but finding their right mind.
Sort of cycle of youth pushing the envelope forward.
We really want to start empowering our youth in our regions to start develop so it can charged social change for Northwest Territories?
I need to push harder to work with specifically Métis communities who are very receptive at this point about talking about anything around healthy sexuality or HIV or harm reduction at a provincial level or a local level or a national level at this point.
Connectivity has been huge, right? To be able to connect, specifically to connect with some of the only other people and organizations that are on the ground doing work specifically with male sex workers. So I was really excited about that, and we've today talked at length and really gotten together, and we're going to continue that conversation.
I made a few connections as well with other organizations here in Toronto they don't work specifically with positive youth as I do, but they do recognize that there are some positive youth among the youth they serve.
I've met a lot of other organizations that do, school-based, like outreach stuff, sexual health education kind of from the margins.
You can't have a really holistic approach if you don't have everyone at the table. And it's just in terms of excluding certain parts of the population in your programming, it's not a really good idea. So we want to really engage all people, bring all people to the fire, so we can dance.
Maybe we could spend less energy complaining and spend more energy getting together and trying to find creative ways to do the work we need to do.
I've gained a lot of resources in terms of trying to get sex-positive education in the schools. I've met with other people who are doing that in the cities. I do HIV and Hep C prevention and awareness in schools, and they're willing to let me go in for that. But when I want to talk about sex and pleasure and power, they get a little iffy.
I'm always amazed at how much work is being done, how many interesting and exciting and innovative projects are actually on the go. From really dynamic, youth and, allies who are just really organizing some amazing stuff to try and reach youth, right? And engage youth in all levels, in all ways, in a way which is going to be relevant, which is a way that they're going to not only get the information that they need, but also have fun with it. We can have fun. I think that's another takeaway piece is this work, as much as it is challenging and it is work, it's also passion and purpose, but it's fun.
All right. We all need to get motorcycles to save on gas, and don't forget the oil-based lube. And a contraceptive beer is a great idea. I think it should be called blanks. And use bureaucracy to fight bureaucracy to get sexy, sex ed in the schools. Traditional street outreach for sex work is changing as more sex work is initiated online. We are seeing more mental health issues in street-involved youth, but not more mental health supports. So let's make all of our centers concurrent disorder centers. Oh, intersectionality. Let's make all of our centers concurrent disorder centers. Oh, intersectionality. And the revolution will not be funded. And let's take Heart's ladder and climb into the tree. And let's keep fishbowl there. Oh, intersectionality.